everyone! I'm back at my favorite place at CSA Medical Aesthetics, and I'm Miss Weng Aguilar Laughlin. I'm 57 years old, and I'm a businesswoman and engaged into a beauty pageant industry as owner of Mutianang Pilipinas, Pampanga. About 8 months ago, I did some procedure on my face, the facelift and the nose thread lift. And today I will do some follow-up to maintain the beauty, natural beauty looking on my face. And today I think another procedure will be done by my only trusted aesthetic physician, no other than our beautiful Dr. Contessa Alapag. And I think she will do just follow-up for another cog lift, thread lift, and also another procedure is the collagen injection for more youthful looking face. So don't forget to click the subscribe button and notification bells. See you!
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up for Ma'am Weng Laughlin.
Hello, everyone.
Welcome back.
Right. I'm back.
Right. So 7 months ago, we did multiple procedures for Ma'am Weng. These are combination treatments for full face rejuvenation. Like on the upper third, we did the fox eye threads. Under eye area, we did some of the PDO thread to strengthen, tighten, and firm the skin under eye area. We also did the reverse malar cog lift, and also like the jawline posterior area reverse cog lift, and some nose PDO threads for the boosting effect of these kinds of treatments, and a little bit of Botox on the glabella, yung may 11. Yeah, and it has been 7 months ago, and I'm still seeing good results for Ma'am Weng. Rejuvenated look. I think people seeing you are kind of amazed with the
Many
outcome.
people, yeah.
Right. A lot of people
they're telling me,
right.
What did I do?
Yeah.
What is the secret? And I, like what I've been telling people, it's not really a secret, So, yeah. Many people notice that I look much younger.
Much younger, right.
Every time, Doc, parang may change daw sa akin.
Every time they
see me.
And they cannot even pinpoint, no?
Yeah,
ano
that's the thing.
Pinagawa mo.
Yeah, that's the thing, There's, parang sabi nila sa akin, may nagbago, pero parang they cannot really identify. Pero talagang, sabi nila na ang ganda daw po ng
It's
face ko.
Result that is very natural. You look refreshed, appropriate for your age, and glowing. Exactly. Tapos parang everything is balanced, harmonious. Yan, yung tinatawag na face harmony. And no surgery. Hindi naman nagpapa-opera si Ma'am Weng. Non-surgical lahat. And habang tumatagal, pabata siya ng pabata. Reversal of aging.
Yes, thanks to CSA and thanks to Dr. Contessa.
It has been like how many years na tayo, right? Na you've been our patient for a very long time, no?
Yeah.
So if we review your photo long time ago with the current photo,
the transformation is amazing.
Yun. Parang pabata ka, no? Parang yung age mo, nag-a-add, pero yung looks mo, bumabata. Which is our goal, actually, in our field, in aesthetic medicine. We wanna, rejuvenate you naturally.
I really feel good about it.
And maganda yung facial expressions. Hindi yung parang frozen face ka, parang paralyzed yung mga hindi na maganda ang movement.
I can still smile. Yeah, natural smile pa.
Natural smile. And for today, since it has been 7 months ago, so we'll be doing some, again, yung mga maintenance treatment. So, we have to still do some procedures to sustain the effects of what we have been doing in the past. Like, for example, of course, your Botox, we need it like at least every 6 months, right? Twice a year. And some of the PDO threads, of course, they're still there. And we just want to work on other areas that we need to work on. Like, for example, I was assessing Ma'am Weng sa kanyang bigonial with yung muscle, yung chewing muscle niya. I palpated it, medyo strong. So, we want to feminize it, narrow the bigonial width. And I was checking on her lips a while ago. A year ago na, right? The last...
More than a year.
Tagal na pala. More than a year na pala yung sa lip enhancement niya. And when we're doing lip enhancement, very subtle, very natural lang. And we were just using 1 ml of our hyaluronic substance. And I was also checking yung mga rickets line, checking on her face profile. Of course, we need, again, dito, yung onse. We need some fine line and wrinkle treatment with our Botox again. And plus, I will support the one we have done last time na reverse lifting. I'll go back with the classic method na parang V-contour ng ating PDO cog thread lifting. We'll show the procedure when we return. And we're back, so we're working on Ma'am Weng's face. So we'll start with the so-called Botox here. So with the Botox, you make a marking from the tragus, corner of the mouth, and then the antegonial notch here, or your mandibular notch here, which is the anterior border of your masseter, and the inferior line and posterior line. And I create a 1 cm. This is a no-go zone for me to avoid the risorius connection. So I'll make 5 injection points for her. Then after we do the Botox, we'll also work on the so-called DAO to kind of like prevent the downturning of the corner of the mouth. So we make a marking of the DAO muscle. So usually we do a 1 cm to 1 cm inferior to that. So my injection point for Asians will be inferior to that point there. So it's like a 1 cm above your mandibular line. So we'll do the DAO as well. Then I'll be adding on with my lip contour. So, Ma'am Weng always want to maintain just natural lips, not that kind of like duck lips or fish lips, right? Then after that, we want Ma'am Weng to have a V contour. So, we're narrowing the bigonial width, and at the same time, we want the jowl fats here to be repositioned again. So, I have an entry point here. This is gonna be the area where I will hang those cog threads, and this is gonna be like starting point here, and then end point there. So, I'll be using also my so-called cog threads. So we have fixing point and hanging point. So this is for the cog threads. Then I'll work on the upper third of the face. We'll be doing again the so-called Botox of your glabella. So this one here, and then we'll work on the corrugators here. So we'll be relaxing that. So injection points here. So usually our doctors, when they make markings, they follow this. So 5 injection points, and I'll be also doing the so-called Botox here. And for my final treatment, it's gonna be the so-called Cold Shine to rejuvenate the face, the skin. So it's a collagen skin booster. Okay, so those are our procedures for Ma'am Weng today. So I'll change my gloves again to make sure that everything is sterile. And so for my botulinum toxin on one side, usually I start with, for women, 25 units per side. So depending on the mass, the muscle mass, the strength of the muscle, the activity of the muscles, your units will depend on those kinds of factors. Okay, I'll start with this side. Disinfect, please. So I have a botulinum toxin in a 40 unit kind of syringe here. It's a 1 ml, it's 40 units here. So I'll be starting with this side here. So for every point, I'll be giving like 5 units because it's gonna be a total of 25. So ideally, you wanna inject the entire masseter muscle, even reaching your so-called DIT or deep inferior tendon. Okay, so we're working on this side here. Then I also wanna relax the so-called depressor anguli oris here. So I go on the inferior and just give my 5 units there. Okay, so my lip filler So I'll start working on the side here. So I'm using a kind of like a soft lip touch. So something to rejuvenate the lips only. Okay. So like the borders here, minimal contour only, because Ma'am Weng only wants subtle. So just the line, just the border. Okay, there you go. So it's called soft lip touch. So restoring volume at the same time recontouring the lips again. So just a little bit here on the borders there. So take note that our lips has a blood supply we call the labial artery. So I noticed there's kind of like an inversion of this corner of the lower lip here. We want that to come out. Okay, just a little bit. Then we'll go with this so-called hug thread. So entry point here. So I'll anesthetize that one and kind of like inject in here. So this is just a lidocaine. So I'm using a long needle here. It's gauge 30 long needle just to numb everything here. So we want to reposition that saggy jowl there. So more lidocaine, please. So Ma'am Weng is already used to a lot of injections. So we've done a lot already. She had all this cog thread lifting for quite some time already. So she's kind of used to this. Okay. So we want a V-contour effect. So this is the classical method that we've been doing. Last time we used the so-called reverse method. Okay, so disinfect the entry point. Then we'll make a puncture there. And I'll use a spiral cog thread here. Gauge 21. And the length is 100 millimeters. I'm just gonna go directly towards that jowl there. So we expect some resistance because of some fibrosis in the tissue. So we're just gonna glide here. So again, the anatomical layer that we usually reach will be the so-called subcutaneous fat with a SMAS layer. Okay, so we just need a good entry point there and just glide it. So this is my second. I'm just gonna use 3 cog threads for Ma'am Weng. Okay, so usually we encounter some resistance. That's expected already because of some fibrosis. Then that's the second, and then a third one. And then we'll also be injecting botulinum toxin on the glabella area and on the forehead region. Then final one will be the so-called cold shine. So procedures like this can be done during your coffee break from work, lunch break from work. Okay, then we're just gonna cut that. So with kinds of procedures like this, we have some, like, you know, people asking, is there like a long recovery period? I could say, yeah, I could say, like, you know, you can go back to your work after this kind of procedure. So a little bit on the forehead area, disinfect this. There you go. So we're just gonna inject Procerus intramuscular, like 2 units, corrugator intramuscular 2 units, the other corrugator 2 units. And the tail, I just usually give 1 unit, and the tail 1 unit. And I'm just gonna work on the right frontalis here. So usually I just give like a micro dose for Ma'am Weng. We still want her to have that natural facial expression. Okay, for Call Shine, so I had a Call Shine, the so-called Skin Booster Call Shine. So usually I start on the periphery and just inject, make the so-called papule technique. Ideally, it's a papule technique. And this is made up of type 1 collagen. And you're already using collagen. Place it in your dermis. Dermis is the layer where we need this extracellular matrix proteins like your collagen. So we want to improve the skin quality, the skin texture. We want to close the pores. Also, those with melasma concerns, this is also a good treatment for them. So we call it the Call Shine Skin Booster. So this is just like injecting like this, making like a papule or a wheel. So we're doing the half face right now, and we're almost done. We'll inject on the temple area here. Okay. So usually we make a wheel. This is a wheel formation. You can call it point by point technique or the intradermal technique. So we're almost done with the right side. So let's now proceed to the opposite side. on our procedures for Ma'am Weng. We'll show the result when we return. And we're back. Let's show the result to Ma'am Weng. Ma'am Weng, ayan na po.
Mirror.
You have a lot of needle
Wow, look at that.
pricks on your face.
You can really tell the effect na doc.
Yeah, you can
Especially
also feel
my lips.
Yeah,
you
the
know?
lips is volumized and kinda also we call it like lip flip. Okay, we kinda invert because there's a lip inversion. So we did a so-called lip eversion. So that's the one we see the instant
Parang-
result right
Para
now.
mag-out yung lips mo. Parang
Yes,
ganon.
to bring out the contour, the line, and restore volume. So, instant result with our lip enhancement. Now, the Botox and also the DAO and the upper third Botox, we still wait for like a max of 2 weeks for the effect of that one to be seen. And also the cog lifting that we have done. So, right now, there's kind of like a sensation that there is something pulling your tissues inside. There's already like a sensation of like it's becoming tight inside.
I can feel it.
Right. So we will still wait for that full effect because right now there's some soft tissue swelling. We injected lidocaine into the soft tissues. We had the tumescent solution. And the Colshine that we used, this Colshine Skin Booster, we injected it intradermally, so we want to place it in the dermis layer where we want to restore those extracellular matrix proteins to kind of help the skin layer, become also firm and tight and get rid also of, lines, wrinkles, and rejuvenate the skin from inside to outside. Yeah. So how was the experience, Ma'am Weng?
Oh, just like before, parang people ask again, is it painful? Siyempre, there is no pain, no gain. So less pain, and what's good about it is there's no downtime.
I know.
So maybe I can just go out and do my regular
Later,
activities. Yes.
yeah, looking at you, you can still
right.
yeah. Can
Yeah,
go out
I
later.
like it, Doc. I like it. Maybe another 5 years younger.
Right. So this
Why
is
not?
again non-surgical, minimally invasive, and we can see some instant result already. And as time passes by, you'll appreciate more improvements. And of course, materials, products that we use here, like they have to go through certain processes before we use them in our center because products should be scientifically studied. It should be like there should be an evidence-based study. There you go. Yeah. So thank you so much, Ma'am Weng.
Thank you. Thank
We'll
you, Doc.
show
Thank you, CSA.
more photos a week, 2 weeks, or more than 2 weeks.
Watch
to
out for
see
the video.
improvement.
Watch out for my video.
And I want to advise you with your diet also. The muscle here, it's really strong.
So-
I notice it's strong.
Oh,
So
really?
if you can avoid
So
too
that
much,
matters pala, no?
yeah.
When you chew food.
Like those, for example, if you eat a lot of steak or meat, those types of food that you have to really chew hard, or you're into nuts, or you do chewing gum, or exercising the masseter muscle. Okay, so it's gonna really make it bigger, wider. So especially for women, we want a V contour. If you want it narrow, you really have to
Yan pala yun.
monitor your muscle here. For women, okay? Kasi
That's a
for
new
men, it's
thing.
okay. Men would want wider angle of the mandible.
Yes.
And we did also the depressor anguli oris. We'll check on that one if it's gonna really reverse that downturned corner of the mouth. Thank you so much, Ma'am Weng.
Thank
you
you so
so
much
much
also.
to all of you. If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics, and our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Ma'am Weng, ano na kasing social media mo so they can follow?
Weng Laughlin and sa Mutya na lang. Mutya ng Pilipinas, Pampanga page.
Right.
Our screening is coming soon, so watch for that.
Yes, we'll watch for that. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetic.